Hi everybody, this is Victor from Getting Healthy Today. Today I'm just talking to you about mental health disorders. I have done a blog talk radio program this whole entire month. I called it the Psychology Series, where I discussed 4 different common mental health disorders, and I did 4 different episodes on my blog talk radio program. Hopefully you can go over there at www.blogtalkradio.com. Getting Healthy Today, you can follow me there, follow the program, check out my other episodes. Yesterday was my 19th episode, believe it or not. When I first started, I didn't even think I was going to go past 1, but I went all the way up to now 19. And next week, I'm going to be discussing cancer, and specifically breast cancer, to honor all those people out there that are suffering from cancer and dedicating it to them. Also, the Relay for Life program is coming out, the fundraiser for all that. My daughter's involved in that as well, so I'm going to be honoring her and talking about her on that show. And everybody out there can definitely support that. It's really good. But going back to lifting the stigma, I'm talking today about lifting the stigma of mental illness. There is so much stigma out there of mental illness, and the problem is that many people don't understand mental illness. And that's usually what the case is. So a lot of times we don't understand anything. So one of the things I want to talk to you about is bipolar disorder. One of the bipolar disorder conditions, we have bipolar 1 and bipolar 2. And the bipolar 1 and 2 have distinct differences between the two. One of them is is just mood disorder, and the other one is a mood disorder and a thought disorder. The manic phase. So one of the things about that is the person has severe mania and also has depression. So when their depression is coming, it's usually sometimes off of a mood disturbance when there's mania. And then when the person goes into a crash, then they start to become really depressed. So there's 2 different distinct differences between bipolar 1 and bipolar 2. So let me just check my notes for me. The notes that I have. All right. It's very specific, so I don't want to. So when we look at bipolar 1, bipolar 1 has at least one manic episode that is preceded or followed by a hypomanic or major depressive episode. Now, bipolar 2 disorder has at least one major depressive episode and at least one hypomanic episode, but never a manic episode. So bipolar 2 doesn't have a manic episode, but bipolar 1 does. So a lot of people that suffer from bipolar disorder, the majority seem to suffer from bipolar 1, and because they have those highs and lows. So if you know somebody has the highs and the lows, it's usually the bipolar 1 disorder. That's usually the case. Okay, is there anybody there that would like to ask any questions out there? Anybody out there? Okay, nobody's out there right now. Okay, well, definitely the different disorders that I spoke about on my Blog Talk radio program. I talked about depression. I talked about bipolar disorder that you just heard. I talked about personality disorders. I did a very extensive discussion about the 3 different types of personality disorders. And there usually are 3 of them. There's type A, type B, and type C. So in those 3 disorders, the type A, B, and C, a lot of times people follow different patterns. So the first ones, if you're a paranoid personality disorder, that's type A. If you have antisocial or borderline personality disorder, that's cluster B. And type C would be someone who has what's called obsessive compulsive disorder. That would be a type C cluster trait personality disorder. And then yesterday, in my Blog Talk radio program that happened yesterday, usually all my Blog Talk radio programs start at 11:30 to 12. And yesterday's episode was on dissociative identity disorder, which is formerly known as multiple personality disorder. And also you might have seen the movie that came out a month or so ago, and it was called Split, and it was the actor James McAvoy who actually portrayed a man that had 23 personalities. But on the movie, he only did 9. But even the 9 that he did were so captivating and so true to the character that he was playing that had these 9 different specific personalities. So if you ever want to see a great movie about displaying somebody with that type of disorder, that's a good movie to look at. Now, the issues that come about with that disorder is the person at least is supposed to have 2 dissociations or 2 personalities that form. And they usually come from a result of severe trauma or abuse starting at childhood. And it can go into a very lifelong process. And there is no specific medications for dissociative identity disorder, is what I talked about yesterday. And yesterday, I talked about a famous major football player from the NFL that actually was diagnosed with dissociative identity disorder. And definitely go to that broadcast to check it out. You'll be surprised to see who that person was if you go there. So if you want to go check that episode out, it's episode 19. It's yesterday's episode, dated the 25th. And you'll hear who I speak about that has dissociative identity disorder. Now, it's very rare, this disorder. They said basically like 0.10 to 1% of the general population have it. So it's a very small percentage of people that have it. And those people that have it sometimes have coexisting conditions such as depression or even borderline personality disorder at some time. But there is some controversy on this disorder that people people that are diagnosed, they tend to say, maybe they don't have this disorder, maybe they have something else. So there's a lot of things that mimic the dissociative identity disorder. But specifically, a person has to describe to you or make you observe them with 2 different dissociations, 2 different personalities. And sometimes that could be, the personality could be a younger child or an older person or somebody else that is quite different from the core personality that you know of that person. So if you see a person that's rather timid and is not really confident, they may possess a personality that's more confident and more able to be a leader of some sort. You see that in the personality of the individual. So it's really important that that you identify that. But the doctors always that do this, the psychiatrists or the mental health professionals, when they diagnose the individual, they have to be specific that the person is actually being observed exhibiting certain conditions from the criteria of that disorder for at least 6 months or better. So a person doesn't necessarily get that disorder right away. They go through that kind of testing and they get observed and they are asked questions about different things and how they exhibit in everyday life. So the functioning of the person is quite impacted. So one of the things that I want everybody to know is that there's a great website out there, and it's called NAMI. It's www.nami.org, and it stands for National Alliance on Mental Illness. They are really great about helping families and friends of families get information and even support groups that they even have for that, any mental health condition. And if you have any questions about a certain mental health condition, that's where you would find some information. There's also another website called www.samhsa.gov, and that stands for Substance Abuse Mental Health Services Administration, and they talk about substance abuse, mental health, and they help people even find if a person's going out of state, say you're moving to California, you go to that website and there's a mental health locator. It tells you about all the different clinics or services that are given in those particular states, and they also do it by county. Years ago, I helped a gentleman that his family was moving with him, or they were moving him to Virginia, and I was able to use that website, which thank God I had it. I was able to give them referrals to different places, and they were able to try the ones that they wanted to try in a specific area that they were going to live in. So it's a great resource to help somebody if they're moving out of state and they can't find the best services. That place has a drop-down menu that helps you with all those different services, which is really, really good. The other website that's very helpful for more information about mental health and what I've talked about in my episodes, if you go to NIMH.hiv.gov, and that's Mental Health Services, National Institute of Mental Health. And they basically help you with the, information about mental health. Okay. So, everyone, later on I'm going to be doing a live broadcast like this about psychology of weight loss. So if anybody out there is looking to lose weight and is actually struggling to lose weight, this might be helpful to you. About 5 ways that I've come up with in my working with trying to lose weight myself. I've helped myself go through this process and learned different techniques that help me understand why it's difficult for even me at times to even lose weight, or even maybe you. So I talk about 5 different components that are important to look at in the psychology of weight loss. And I'll be doing that today at 3 o'clock, and we'll discuss that. And if you have any questions, feel free to share that video with everybody when you see it, and also this video when you see it as well. All right, everybody, thank you very much for your time. Again, if you'd like to see the 4 episodes that I did in honoring the people with mental health conditions this whole entire month, it was called Psychology Series, Lifting Up the Stigma. I did 4 different episodes, and it is available on iTunes or Stitcher Radio. And the name of the program is Getting Healthy Today, Impacting People's Lives. And those are my podcasts. If you have any more information, feel free to like and share this video and comment below, and let me know if you've gotten some value today. Have a nice day, everybody, and I'll see you hopefully at 3 p.m. today. Take care.